The morning sun filtered through the tall windows of Kensington Palace, casting long shadows across the pristine gardens. 8-year-old Princess Charlotte walked along the stone pathway, her small shoes clicking against the ground with each careful step. She had always been curious, perhaps too curious for her own good. Today was no different. The palace grounds were buzzing with activity. Gardeners trimmed hedges into perfect shapes, while security personnel made their routine rounds. Charlotte spotted Officer James Morrison stationed near the East Wing entrance. He was a tall man with kind eyes, someone who had been part of the royal security team for nearly 15 years. Children always made him smile, especially this particular princess who reminded him of his own daughter. Charlotte approached him with something clutched in her left hand. Morrison noticed immediately that something was wrong. The young princess's face was pale, and she was holding her hand in an unusual way, close to her chest. Her uniform dress, usually spotless, had small spots of red on the white collar. "Excuse me, Officer Morrison," Charlotte said, her voice trembling slightly. "I think I need some help." Morrison immediately knelt down to her eye level, his training kicking in. He had dealt with many situations in his career, but seeing a child in distress always affected him differently. His heart rate quickened as he tried to assess the situation calmly. "What happened, Your Royal Highness?" he asked gently, trying to keep his voice steady. Charlotte slowly opened her left hand. Morrison's eyes widened. A large splinter, nearly 2 inches long, was embedded deep in her palm. The wood fragment was thick, almost like a small steak, and the surrounding skin was angry and red. Blood had dried around the edges, suggesting this had happened some time ago. The officer felt his stomach drop. "I was climbing the old oak tree near the greenhouse," Charlotte explained, her words coming out in a rush. "The one with the tire swing. I know I'm not supposed to climb that high, but I wanted to see if I could spot the horses in the distant field. There was this branch and it looked strong enough, but when I grabbed it, it broke. I tried to catch myself, and my hand went right into the rough part of the trunk." Morrison listened carefully, already mentally preparing the report he would need to file. But more importantly, he was evaluating the injury. The splinter was deep, very deep. This wasn't something that could be pulled out with tweezers in the palace kitchen. This required proper medical attention. "When did this happen?" Morrison asked, keeping his tone calm to avoid frightening her further. Charlotte bit her lip, a gesture that reminded Morrison painfully of his own daughter when she was in trouble. "About an hour ago. Maybe more. I tried to pull it out myself, but it hurt too much. I didn't want to tell anyone because I thought I'd get in trouble for climbing so high. But then it started hurting more and more, and I saw more blood, and I got scared. An hour." Morrison's mind raced. An hour was a long time for a foreign object to be embedded in skin, especially for a child. He knew that splinters, particularly large ones from old trees, could carry bacteria. Infection was a real risk. He needed to act fast, but he also needed to follow protocol. "You did the right thing by coming to tell me," Morrison said, carefully examining the hand without touching it. "I need to call for medical help right away. This needs proper treatment from doctors who know exactly what to do." Charlotte's eyes filled with tears. "Am I going to be okay? Will they have to cut my hand?" No, Morrison reassured her quickly, though his concern was growing. "The doctors are very good at handling things like this. They'll know exactly how to help you. But I need you to stay very still and not try to move that splinter at all. Can you do that for me?" The princess nodded, cradling her injured hand carefully. Morrison stood up and immediately reached for his radio. His hands were shaking slightly, something that rarely happened to him even in tense situations. But this was different. This was a child, and not just any child, but a member of the royal family under his protection. "Control. This is Morrison at East Wing entrance," he spoke into his radio, his voice professional despite his racing heart. "I need immediate medical assistance for Princess Charlotte. She has sustained an injury to her left hand. The injury involves a foreign object deeply embedded in the palm. Requesting emergency medical team to East Wing entrance immediately." The response came back almost instantly. "Copy that, Morrison." Medical team dispatched. Ada 3 minutes. What is the nature of the foreign object? Large wooden splinter, approximately 2 inches in length, deeply embedded in the left palm. Patient states injury occurred approximately 1 hour ago. Some bleeding present, appears to have partially clotted. Patient is alert and responsive but in visible discomfort. Understood. Keep the patient calm and still. Do not attempt removal. Medical team en route. Morrison knelt back down beside Charlotte, who was trying very hard to be brave. Tears were rolling down her cheeks, but she wasn't sobbing. He could see she was fighting to maintain composure, probably something she had been taught from a young age. It made his heart ache. The doctors will be here very soon, he told her softly. You're being very brave. Would you like to sit down while we wait? Charlotte nodded, and Morrison carefully guided her to a nearby bench. He sat beside her, maintaining a respectful distance but staying close enough to provide comfort. He could see the splinter more clearly now in the better light. It was worse than he had initially thought. The wood had penetrated at an angle, and he could see a small piece of bark still attached to the part sticking out of her skin. Does it hurt very much? Morrison asked. It throbs, Charlotte said, her voice small. Like my heartbeat is in my hand. And it stings when I move my fingers even a little bit. Morrison nodded, making mental notes of everything she said. The medical team would need this information. He glanced at his watch. 2 minutes had passed since he made the call. It felt like much longer, Officer Morrison. Charlotte said quietly, Yes, Your Royal Highness. Are my parents going to be very cross with me? I wasn't supposed to climb that tree. Mummy told me it was too old and some of the branches might be weak. Morrison considered his words carefully. Your parents love you very much. Right now, they'll just be worried about making sure you're okay. That's what matters most. We can worry about tree climbing rules later. In the distance, Morrison could hear the sound of quick footsteps. The medical team was arriving. He stood up, positioning himself so he could see both Charlotte and the approaching personnel. His protective instincts were in full force now. Even though these were palace medical staff, people he knew and trusted, his job was to ensure the princess's safety at all times. 3 people rounded the corner. Dr. Sarah Mitchell led the team, her medical bag already open in her hands. Behind her were 2 nurses, both carrying emergency equipment. They moved with practiced efficiency, their faces serious but calm. Officer Morrison, Dr. Mitchell said as she approached. Report. Morrison quickly relayed all the information again while the doctor knelt beside Charlotte. Dr. Mitchell's expression remained professional, but Morrison caught the slight tightening around her eyes as she examined the injury. It confirmed what he already suspected. This was serious. Dr. Mitchell worked with quiet efficiency, her eyes focused on Charlotte's injured hand. She pulled out a small flashlight and examined the splinter carefully from different angles. The nurses stood ready with supplies, their hands hovering near sterile gloves and antiseptic wipes. Charlotte. I'm Dr. Mitchell, the doctor said warmly. Her voice gentle despite the serious situation. I've seen a lot of splinters in my time, and I promise we're going to take very good care of you. Can you tell me exactly how this happened? Don't leave out any details, even the small ones. Charlotte repeated her story, this time with more details. She explained how she had been watching the gardener's work and decided to climb the oak tree to get a better view. She described the moment the branch cracked, the feeling of falling, and her instinctive grab for the trunk to steady herself. The rough bark had scraped her palm first, and then the broken branch had somehow become a sharp projectile that drove into her hand. I felt it go in, Charlotte said, her voice shaking at the memory. It made a crunching sound like when you bite into a carrot. And then there was this burning feeling that spread all through my hand. Dr. Mitchell nodded, writing notes on a small tablet. That's very helpful information, Charlotte. You're doing wonderfully. Now, I need to ask you some important questions. Have you felt dizzy at all? Any nausea or feeling like you might be sick? Charlotte shook her head. No, just my hand hurts. And my chest feels tight, but I think that's because I'm nervous. That's completely normal, Dr. Mitchell assured her. Being nervous is okay. Now, I'm going to very gently touch around the area of the injury, not the splinter itself, just the skin around it. I need to check for some things. Tell me if anything I do makes the pain worse. The doctor's gloved fingers pressed carefully around the wound. Charlotte winced but didn't pull away. Morrison watched from a respectful distance, his radio still in hand in case additional support was needed. He had already sent a discreet message to the senior security team, who would need to inform the Duke and Duchess of Cambridge. "The good news," Dr. Mitchell said after her examination, "is that I don't think any major blood vessels have been damaged. The bleeding has stopped, which is positive. However, this splinter is quite deep, and it's at an angle that makes simple removal risky. I'm going to need to take you to the medical suite where we have proper equipment and lighting. Will it hurt?" Charlotte asked the question that every child asked in these situations. "I'm going to be completely honest with you," Dr. Mitchell said, looking directly into the young princess's eyes. "We're going to give you medicine that will make your hand feel numb, like when your foot falls asleep, but on purpose. You might feel some pressure and pulling, but it shouldn't hurt. The medicine itself might sting a little bit when it goes in, like a pinch, but only for a few seconds." Charlotte considered this, then nodded bravely. "Okay, I can handle a few seconds." One of the nurses, a woman named Rebecca, who had worked at the palace for 12 years, stepped forward with a soft sling made from clean gauze. "Your Royal Highness, I'm going to support your hand in this sling so it doesn't move around while we walk to the medical suite. Is that all right?" "Yes, thank you," Charlotte said politely. Even in her distressed state maintaining the manners that had been ingrained in her since she could talk. As Nurse Rebecca carefully positioned the sling, Morrison's radio crackled to life. "Morrison, this is Control. The Duke and Duchess have been notified and are on their way. ETA 10 minutes. They were at an engagement in Westminster." "Copy that," Morrison responded. He looked at Dr. Mitchell. "The parents are en route." Dr. Mitchell nodded. "We'll have her in the medical suite and beginning treatment. They can join us there. Charlotte, your mummy and daddy are coming. They'll be here very soon." Relief washed over Charlotte's face, though she tried to hide it. "They're not going to be angry?" "Darling, they're going to be concerned and wanting to help you feel better," Dr. Mitchell said kindly. "Parents worry first, everything else comes later." The group began moving toward the medical suite, which was located in a secure wing of the palace specifically designed for royal family healthcare. Morrison walked alongside them, his eyes constantly scanning the corridors. Even in an emergency, security protocols had to be maintained. Other staff members they passed stopped and stepped aside, their faces showing concern when they noticed the young princess with her hand in a sling. The medical suite was a state-of-the-art facility that looked more like a high-end private clinic than a hospital. The walls were painted in soft, calming colors, and there were paintings of countryside scenes that Charlotte had always found soothing. Dr. Mitchell led her to an examination room that had been quickly prepared by the advanced nurse. "Let's get you comfortable," Dr. Mitchell said, helping Charlotte onto a special examination chair that could recline and adjust to different heights. "Rebecca is going to take your vital signs while I prepare everything we need." Nurse Rebecca wrapped a blood pressure cuff around Charlotte's right arm and placed a small clip on her finger to measure her oxygen levels. "You might feel a little squeeze," she warned before inflating the cuff. Charlotte watched the numbers on the monitor with curious eyes, momentarily distracted from her injured hand. "What do those numbers mean?" "They tell us how your heart is working and how well oxygen is moving through your body," Rebecca explained, pleased to have something to keep the princess's mind occupied. "Your numbers are very good. Your heart is strong and healthy." Dr. Mitchell was at a sterile tray, laying out instruments with practiced precision. There were forceps of different sizes, tweezers, scissors, antiseptic solutions, and syringes for the local anesthetic. She also had a special magnifying light that would allow her to see the splinter's exact position and depth. "Charlotte, I want to explain exactly what's going to happen," Dr. Mitchell said, rolling a stool over to sit at eye level with her patient. First, I'm going to clean the area around the splinter very thoroughly with antiseptic. That might feel cold and a bit uncomfortable, but it won't hurt. Then I'm going to give you an injection of numbing medicine. That will sting for about 5 seconds, like I mentioned, but then your hand will start to feel tingly and then numb. We'll wait a few minutes to make sure the medicine is working completely. Then I'll remove the splinter and clean the wound thoroughly. After that, I might need to put in 1 or 2 stitches if the wound edges are too far apart to heal on their own. Finally, I'll bandage everything up and we'll give you some medicine to prevent infection. Charlotte absorbed all of this information, her face serious. Will I be able to use my hand afterward? Yes, absolutely, Dr. Mitchell assured her. You'll need to keep it clean and dry for a few days, and you won't be able to climb any trees for at least 2 weeks while it heals. But you'll have full use of your hand. You might have a small scar, but it will fade over time. Morrison remained by the door, his presence a silent reassurance. He had seen the princess grow up, had watched her take her first steps in the palace gardens, and had often been the one to gently redirect her when her adventurous spirit led her into off-limits areas. Seeing her in pain affected him more than he cared to admit. Dr. Mitchell began the cleaning process. The antiseptic solution was cold, and Charlotte tensed but didn't pull away. The doctor worked methodically, using cotton swabs to clean around the splinter without disturbing it. The area looked worse up close. The skin was inflamed, and there were small scratches from the bark surrounding the main wound. You're doing brilliantly, Dr. Mitchell encouraged. I'm almost done with the cleaning. Now comes the injection. Rebecca, can you hold Charlotte's other hand? The nurse moved to Charlotte's right side and gently took her uninjured hand. You squeeze as hard as you need to, Rebecca said with a warm smile. I have 5 brothers. I've been squeezed by the best. Dr. Mitchell picked up the syringe containing the local anesthetic. Okay, Charlotte. Remember, just a few seconds of stinging and then it will be over. Take a deep breath in and let it out slowly. I'll do it on the count of 3. 1, 2, 3. The needle went in swiftly and precisely. Charlotte squeezed Rebecca's hand hard, her face scrunching up, but she didn't cry out. True to Dr. Mitchell's word, the sharp sting lasted only a few seconds before the doctor withdrew the needle. All done with that part? Dr. Mitchell said proudly. You were so brave. Now we wait a few minutes for the numbness to set in. Charlotte's eyes were watery, but she managed a small smile. That wasn't as bad as I thought it would be. You're tougher than you think, Rebecca said, gently loosening her grip on Charlotte's hand, which had turned slightly red from the squeeze. Just then, there was a sound at the door. Morrison turned and his expression softened. The Duke and Duchess of Cambridge had arrived, their faces etched with concern. Behind them was Prince George, who had insisted on coming when he heard his sister was hurt. Catherine rushed to her daughter's side, her composure slipping for just a moment as maternal instinct overrode royal protocol. William followed closely, his face a mixture of concern and relief that his daughter was being cared for. George hung back slightly, his young face worried as he saw his sister in the medical chair. Oh, sweetheart, Catherine said softly, brushing Charlotte's hair back from her forehead. Are you all right? What happened? I'm okay, Mummy, Charlotte said, though her voice wavered. I did something silly. I climbed the old oak tree, the one you told me not to climb, and I got hurt. William exchanged a quick glance with Dr. Mitchell, who gave him a subtle nod that communicated the situation was under control. He then turned his attention to his daughter. The important thing is that you're being looked after now. We can talk about the tree later. I'm so sorry, Charlotte said, fresh tears forming. I know I wasn't supposed to. I just wanted to see the horses, and the tree seemed like the perfect spot. Accidents happen, Catherine said gently, though her eyes were scanning her daughter's injury with a mother's sharp attention. She could see the splinter protruding from the palm, and her face paled slightly. That's quite a large splinter. Dr. Mitchell is going to remove it, Charlotte explained, sounding more confident now that her parents were there. She gave me medicine to make my hand numb. I can already feel it starting to tingle. Dr. Mitchell stood and greeted the Duke and Duchess properly. Your Royal Highnesses, Princess Charlotte has been very brave. The injury is significant but manageable. The splinter penetrated deeply into the palm, but preliminary examination suggests no damage to tendons or major blood vessels. I've administered local anesthetic, and once it takes full effect, I'll remove the foreign object and assess whether sutures are necessary. How long has she been injured? William asked, his jaw tightening slightly. She reports the incident occurred approximately 90 minutes ago, Dr. Mitchell said. She attempted to manage it herself initially before wisely seeking help from Officer Morrison. All eyes turned to Morrison, who had remained a respectful distance away. The princess approached me at the East Wing entrance, he confirmed. She was very clear in explaining what had happened. I immediately called for medical assistance. Thank you, James, Catherine said warmly, using Morrison's first name, which she rarely did. It was a mark of genuine gratitude. You did exactly the right thing. Morrison nodded, feeling a flush of pride at the acknowledgement. Just doing my job, Your Royal Highness. George stepped closer, peering at his sister's hand with the morbid curiosity typical of a 10-year-old boy. Does it hurt terribly? Can you see the whole splinter? How deep do you think it is? George, give your sister some space, William said gently, though he couldn't help but smile at his son's inquisitive nature. It's okay, Daddy, Charlotte said. It hurt a lot before, but now it's just feeling fuzzy and strange. I can still feel pressure, but the sharp pain is going away. Dr. Mitchell tested the anesthetic's effectiveness by gently touching around the wound site. Can you feel this, Charlotte? I can feel you touching, but it doesn't hurt. It's like my hand is there, but also not there at the same time? Perfect, Dr. Mitchell said with satisfaction. The anesthetic is working beautifully. We can proceed with the removal. Now, Your Royal Highnesses, you're welcome to stay. But I should warn you that there may be some bleeding once the splinter is removed, and the process might be slightly uncomfortable to watch. We'll stay, Catherine said firmly, taking up a position where she could hold Charlotte's other hand without interfering with Dr. Mitchell's work. William stood on the opposite side, his hand on Charlotte's shoulder, providing silent support. Dr. Mitchell pulled on fresh gloves and positioned the magnifying light directly over Charlotte's palm. In the bright illumination, every detail of the injury was visible. The splinter had entered at a shallow angle, traveling into the meat of the palm. The wood was old and had started to splinter at the entry point, creating several smaller fragments surrounding the main piece. I'm going to start now, Dr. Mitchell announced. Charlotte, you'll feel tugging and pressure, but remember, it shouldn't hurt. If you feel any sharp pain, tell me immediately. Everyone else, I need quiet so I can concentrate. The room fell silent except for the soft hum of medical equipment. Dr. Mitchell picked up a pair of fine-tipped forceps and carefully gripped the exposed end of the splinter. Her movements were slow and deliberate. The slightest wrong angle could break the splinter, leaving fragments embedded in the tissue that would be much harder to remove. The splinter is intact, she murmured, more to herself than anyone else. Good structural integrity. Coming out straight will be the challenge. She applied gentle traction, testing resistance. The splinter moved slightly but didn't slide free. Dr. Mitchell's brow furrowed in concentration. She adjusted her grip and tried again. This time at a marginally different angle. Charlotte watched with fascination, detached from the procedure by the numbing medicine. I can feel pulling, she reported, but it's not painful. That's exactly what we want to hear, Dr. Mitchell said. She increased the pressure slightly, maintaining steady traction. The splinter shifted more, beginning to emerge from the wound. A small trickle of blood followed it. Catherine's grip on Charlotte's hand tightened involuntarily, but she kept her face calm. William's expression was stoic, though Morrison noticed the Duke's other hand had formed a tight fist at his side. Almost there, Dr. Mitchell said. The splinter was halfway out now. She paused, reassessing the angle. The wood had left a track through the tissue, and she needed to follow that same path to minimize additional damage. With one final, smooth pull, the splinter came free. It was even larger than it had appeared while embedded. In Dr. Mitchell's forceps, The piece of wood measured nearly 3 inches long and was as thick as a pencil at its widest point. One end was sharply pointed, while the other showed the ragged break where it had separated from the branch. "Good Lord," William breathed. Seeing the full extent of what had been in his daughter's hand, Charlotte's eyes widened. "That was inside my hand? The whole thing?" "The whole thing," Dr. Mitchell confirmed, placing it in a sterile container. "You're very lucky. A few millimeters in a different direction and this could have been much more serious." Blood was now flowing more freely from the wound. Nurse Rebecca immediately stepped in with gauze. Applying pressure, Dr. Mitchell examined the wound opening carefully with her magnifying light. "I can see some smaller wood fragments," she announced. "I'll need to irrigate the wound thoroughly and remove any debris before closing." She selected a syringe filled with sterile saline solution and began flushing the wound. The process looked uncomfortable even to the observers, but Charlotte remained remarkably calm. Perhaps she was beginning to process the reality of what had happened. Or perhaps the relief of having the main splinter removed was overwhelming any other sensation. "I'm seeing some clean edges here," Dr. Mitchell said, using sterile tweezers to remove several tiny splinters that the irrigation had loosened. "Good tissue perfusion. The wound is about 1 inch long at the surface. Charlotte, I'm going to need to put in 3 small stitches to help this heal properly. The stitches will dissolve on their own in about 10 days, so we won't need to remove them. You'll feel tugging but no pain. Will the stitches show?" Charlotte asked, ever conscious of appearances even at her young age. "They'll be very small," Dr. Mitchell assured her. "And as I mentioned, you might have a tiny scar, but it will be minimal. Many people have small scars from childhood adventures. They're like badges of courage." The stitching process was meticulous. Dr. Mitchell made each stitch carefully, ensuring proper alignment of the wound edges for optimal healing. Catherine watched each stitch go in, her medical knowledge from various patronages helping her understand the precision required. 1, 2, 3, and we're done, Dr. Mitchell announced, tying off the final stitch. "Now I'm going to apply an antibiotic ointment and bandage everything up. Charlotte, you'll need to keep this dry for at least 48 hours. No hand washing directly on the bandage. We'll give you a waterproof cover for bathing." As Dr. Mitchell wrapped the hand in clean white gauze, creating a neat professional dressing, the tension in the room began to ease. The immediate crisis was over. Charlotte's hand was bandaged securely, but not so tightly as to impede circulation. "How are you feeling?" William asked his daughter, his voice gentle. "Tired," Charlotte admitted. "And my hand feels weird, like it's not really mine." "Is that normal?" "Completely normal," Dr. Mitchell said. "The anesthetic will wear off in a few hours. When it does, your hand will start to hurt again, but I'm going to give you some medicine to help with that. Rebecca, can you prepare the discharge instructions and prescriptions?" Nurse Rebecca nodded and moved to a computer terminal, beginning to type up the necessary paperwork. Dr. Mitchell turned to address the family as a whole. "Charlotte has been an exemplary patient. The wound is clean, properly closed, and I don't anticipate any complications. However, there are some important things we need to watch for. Any signs of infection, redness spreading beyond the bandaged area, fever, or increased pain should be reported immediately. She needs to return in 5 days for a wound check, and again in 10 days to ensure the stitches have dissolved properly and healing is progressing well." "What about antibiotics?" Catherine asked, her practical nature coming through. "Yes. I'm prescribing a course of antibiotics as a precaution, Doctor," Mitchell confirmed. "Old wood can harbor bacteria, and even though we've cleaned the wound thoroughly, it's better to be safe. She'd take them for 7 days. I'm also providing pain medication, though over-the-counter children's paracetamol should be sufficient once the local anesthetic wears off." Morrison, who had been quietly observing throughout the entire procedure, felt a wave of relief wash over him. The princess was going to be fine? His quick action in calling for medical help had been the right decision, and everything had worked out well. The medical suite gradually transformed from a place of urgent care to one of recovery and relief. Charlotte sat up straighter in the examination chair, her bandaged hand resting carefully on her lap. The color had returned to her cheeks, and though she looked tired, her eyes were bright and alert. "Can I see the splinter again?" George asked, his curiosity undiminished. "I want to show my friends at school." "They'll never believe Charlotte got such a massive piece of wood stuck in her hand." "George," William said with a hint of warning in his tone, though his lips twitched with amusement. "Actually," Dr. Mitchell said thoughtfully, "I don't see why not. We've preserved it in a sterile container. It's quite an impressive specimen, if I may say so." She retrieved the container and held it up to the light. The splinter looked even more formidable contained in the clear plastic, its jagged edges and considerable length testament to the accident's seriousness. George leaned in, fascinated. "It's enormous." "Charlotte, you're so brave." I would have been screaming. "I wanted to scream," Charlotte admitted quietly. "But I remembered what you always tell us, Daddy, about staying calm in difficult situations. And Officer Morrison was so kind that it made me feel safer." William looked over at Morrison, who had been preparing to leave now that the crisis was resolved. "James, a moment, please." Morrison approached, standing at attention. "Your Royal Highness." "I want to thank you personally," William said, extending his hand. "Your quick thinking and calm response made a significant difference today. Charlotte was fortunate to come to you." Morrison shook the offered hand, feeling genuinely moved. "Thank you, sir. I'm just glad I could help." "The princess was very brave throughout." Catherine added her thanks as well. "You've been wonderful, James. We're grateful to have people like you looking after our family." "It's my honor, Your Royal Highness," Morrison said sincerely. "If there's nothing else, I should return to my post and file the incident report." "Of course," William said. "Please make sure to note in your report that Charlotte's cooperation and clear communication about what happened contributed significantly to the positive outcome." Morrison nodded, understanding the subtext. The Duke wanted it documented that Charlotte had handled herself well, despite her initial rule-breaking. It was a kindness that would be noted in official records, showing understanding rather than just discipline. After Morrison left, Dr. Mitchell began explaining the care instructions in detail. She demonstrated how to check the bandage for signs of bleeding or discharge, how to apply the waterproof cover for bathing, and when to administer the medication. "The pain will return gradually," Dr. Mitchell explained. "It won't be sudden, but over the next few hours as the anesthetic wears off, Charlotte will begin to feel increasing discomfort. Start the pain medication before the discomfort becomes severe. It's easier to manage pain before it peaks." "I understand," Catherine said, accepting the printed care instructions from Nurse Rebecca, "and will watch carefully for any signs of infection." Charlotte, who had been listening quietly, spoke up. "Dr. Mitchell, will I still be able to write?" "I have schoolwork to complete." "You can write, but it might be uncomfortable for the first few days," Dr. Mitchell said. "Your right hand is fine, and your left hand will heal. Try to avoid putting pressure on the palm while writing. If it becomes too difficult, I can provide a note for your teachers explaining the injury." "That won't be necessary," Charlotte said with determination. "I'll manage. I'm left-handed, but I can be more gentle with how I hold my pencil." Catherine smiled at her daughter's resilience. "We'll see how it goes. There's no shame in needing extra time to heal properly." As they prepared to leave the medical suite, George suddenly asked, "What about the oak tree? Will it be cut down?" The question hung in the air. William considered it carefully. "The tree has been there for over 100 years. It's not the tree's fault that branches can be weak. I think instead we'll have the groundskeepers inspect it thoroughly and remove any dangerous branches. We'll also make the rule clearer that no one climbs trees without permission and without someone supervising." "That seems fair," Charlotte said softly. "I really am sorry, Daddy. I knew the rule and I broke it anyway. I'd put myself in danger, and I could have been hurt much worse." William knelt down to his daughter's eye level, being careful not to jostle her injured hand. "Charlotte, you made a mistake. An understandable one, because you're curious and adventurous, and those are good qualities. But you're right that you broke a rule that exists for your safety. What's most important to me is that when you were hurt, you didn't let pride or fear of getting in trouble stop you from seeking help. You told Officer Morrison the truth about what happened, which allowed him to get you proper medical care quickly. That shows good judgment and character. So I'm not in trouble? Charlotte asked, surprised. You're going to have extra lessons on safety protocols, William said with a gentle smile. And you'll be writing a thank you note to Officer Morrison and to Dr. Mitchell and her team. But no, you're not in trouble. You've learned your lesson the hard way, I think. Catherine added, and darling, in the future, if you want to do something, like climb a tree or explore somewhere new, come ask us first. We can arrange it safely. Part of growing up is learning to balance your desire for adventure with making smart choices. Charlotte nodded, relief evident on her face. I promise I'll ask first from now on. This was scary enough to teach me. Dr. Mitchell approached with a final item, a small card. Charlotte, this is my direct number. If you have any concerns about your hand over the weekend, any questions at all, you call me. Day or night, don't hesitate. Thank you so much, Doctor Mitchell, Charlotte said politely. And thank you, Nurse Rebecca. You both were wonderful. You were a model patient, Dr. Mitchell said warmly. I've treated adults who weren't nearly as brave as you were today. The family made their way out of the medical suite, George walking beside his sister protectively, one hand hovering near her elbow as if ready to steady her if she stumbled. It was a touching gesture of sibling care that made both parents smile. As they walked through the palace corridors, they passed several staff members who had heard about the incident. Each one offered words of concern and wishes for Charlotte's quick recovery. The young princess thanked each person graciously, despite her growing tiredness. I think when we get back to our rooms, someone needs a rest, Catherine observed. It's been quite an eventful morning. I am rather tired, Charlotte admitted. My whole body feels heavy. That's the adrenaline wearing off, William explained. Your body went through a stressful experience, and now that the danger has passed, you're feeling the aftermath. A good rest will help tremendously. When they reached their private quarters, Catherine settled Charlotte on a comfortable sofa with cushions propped around her. She brought a soft blanket and draped it over her daughter's legs. George, still concerned, brought Charlotte's favorite stuffed rabbit, which she had owned since she was a baby. Here, he said, placing the well-worn toy beside her. Barnaby always makes things better. Charlotte smiled at her brother, touched by his thoughtfulness. Thanks, George. You're the best brother. William sat down in a nearby chair, his expression contemplative. You know, Charlotte, every person who lives in this palace, everyone who has ever lived here, has stories of accidents and close calls. My grandfather once fell off a horse and broke his collarbone. Your great-grandmother put her hand through a window when she was about your age. These things happen in life. Really? Charlotte asked, interested despite her exhaustion. Really, Catherine confirmed. And each time, the important thing was that people were honest about what happened and got the help they needed. Just like you did today. The medication Dr. Mitchell had provided began to take effect, and Charlotte's eyelids grew heavy. Within minutes, she had drifted off to sleep, her bandaged hand resting gently on Barnaby the rabbit. William and Catherine watched their daughter sleep, their faces reflecting the complex mix of emotions parents feel when their child is hurt. Relief that it wasn't worse, residual fear from the what-ifs, pride in how she had handled herself, and fierce, protective love. I should inspect that tree myself, William said quietly. Make sure there are no other weak branches that could cause problems. Tomorrow, Catherine said firmly. Today, we just be grateful she's all right. In another part of the palace, Officer Morrison was completing his detailed incident report. He typed out every detail, from the moment Charlotte approached him to the point when the medical team took over her care. He noted her clarity in explaining what had happened, her bravery during the initial examination, and the excellent response time of the medical team. As he finished the report, his superior officer, Captain Edwards, stopped by his desk. I heard about the princess. Well done, Morrison. Textbook response to a medical emergency. "Thank you, Captain," Morrison said. "I'm just relieved she's going to be fine." "The Duke called down to commend your actions," Edward said. "That's going in your permanent file. It's not every day we get direct praise from the family." Morrison felt a warm flush of pride but kept his voice modest. "I was just doing what anyone would do. The princess needed help, and I provided it." Edward smiled. "That's exactly the attitude we need. But don't downplay it. You kept a calm head, made the right call, and followed protocol perfectly. That matters." After his shift ended, Morrison went home to his own family. His daughter, Emily, was doing homework at the kitchen table when he arrived. She looked up and smiled. "Dad, how was work?" Morrison hung up his jacket and sat down beside her. "Eventful. I helped someone who was hurt today." "Who?" Emily asked, curious. "Can't say specifics," Morrison said, bound by the confidentiality requirements of his position. "But it reminded me that teaching you kids about safety is so important. Promise me you'll always tell an adult if you're hurt, even if you think you might be in trouble for whatever caused the injury." Emily looked at her father's serious expression and nodded. "I promise, Dad. We learned that in school, too. Safety first." "That's my smart girl," Morrison said, ruffling her hair affectionately. Back at the palace, Charlotte woke from her nap as the late afternoon sun streamed through the windows. Her hand was beginning to throb as the local anesthetic wore off completely. She grimaced, and Catherine, who had been reading nearby, immediately noticed. "Time for your pain medicine, I think," Catherine said, retrieving the prescribed medication and a glass of water. Charlotte took the medicine obediently, washing it down with water. "It hurts more now," she admitted. "The doctor said it would," Catherine reminded her gently. "But the medicine will help soon? Let's keep your hand elevated on this pillow. That will reduce the throbbing." As they sat together, Charlotte asked, "Mummy, do you think the other children will tease me about this? About being silly and getting hurt?" Catherine considered her answer carefully. "Some might make comments, but true friends will understand that accidents happen. And you know what? This experience taught you something valuable. You learned about consequences, about honesty, and about how to respond in an emergency. Those are lessons that will serve you your whole life." "I suppose that's true," Charlotte said thoughtfully. "And it is rather an interesting story." "It certainly is," Catherine agreed with a smile. "Though perhaps next time you want an interesting story, we can find a safer way to create one." "Agreed," Charlotte said emphatically. "I don't need another adventure like this one." Over the following days, Charlotte's hand healed well. She followed all of Dr. Mitchell's instructions carefully, keeping the bandage clean and dry, taking her antibiotics as prescribed, and resisting the urge to pick at the stitches as they began to dissolve. The wound check on day 5 showed excellent healing, and by day 10, the stitches had dissolved completely, leaving only a thin pink line that would eventually fade to a barely noticeable scar. The oak tree was thoroughly inspected by professional arborists who removed several weak branches and declared the tree fundamentally sound. A new rule was established that tree climbing would only be permitted in designated trees and with adult supervision, a rule that both Charlotte and George agreed was sensible. Charlotte wrote thoughtful thank you notes to Officer Morrison, Dr. Mitchell, and Nurse Rebecca. In each note, she expressed genuine gratitude for their care and kindness. Morrison framed his note and kept it on his desk at home, a reminder of why he loved his job. The splinter itself became a bit of a legend in the Cambridge household. It remained in its sterile container, and occasionally Charlotte would show it to friends, telling the story with dramatic flair about her adventure and rescue. She never embellished the facts, but she told them in a way that made everyone laugh, including herself. Years later, when Charlotte would look at the faint scar on her palm, she would remember that day not as a moment of fear or pain, but as a lesson in resilience, honesty, and the importance of asking for help when needed. She would remember Officer Morrison's kind eyes, Dr. Mitchell's steady hands, and her parents' loving concern. She would remember that being brave didn't mean never making mistakes or never feeling afraid. It meant doing the right thing even when you were scared, and trusting the people around you to help you through difficult moments. The old oak tree continued to stand in the palace gardens, its remaining branches strong and healthy. And sometimes, when Charlotte walked past it, she would pat its trunk affectionately, grateful for the lesson it had inadvertently taught her, even if the learning had come with a bit of pain. Life, she had learned at 8 years old, was full of adventures, some planned and some accidental, and the key was to approach them all with honesty, courage, and a willingness to learn.
Thanks for watching.